Here's Rod Starnes.
Good afternoon. It is now time to record your vital signs.
A friendly voice puts Tamika Nelson through her paces daily, and she wouldn't have it any other way. Tamika suffers from high blood pressure and congestive heart failure and needs consistent monitoring. But 3 home nursing visits a week and 4 trips to the doctor's office a month were getting to be too much.
It was a very difficult situation, continuously going to the doctor, being there all day, and then coming home. Then I got to meet with my nurse, with her on her schedule, and her trying to work with my schedule. It was very difficult.
On the days she was alone, Tamika had more than a few health problems that landed her in the emergency room.
Oh, that happened anywhere from 5 or 6 times, 7 times a year. Over a month period of time, it happened one time, about 4 times a month. I was basically in and out of ER.
But Tamika's not alone anymore.
Please step on the scale.
The HomMed monitoring system is helping Tamika stay healthy.
We can monitor their vital signs every day, 7 days a week. The information is transmitted via the telephone line or SkyTel if the patient doesn't have a telephone, and it goes into a central station where a nurse monitors the results.
Miss Nelson, how you doing this morning? Good. I'm just looking at your monitor. Looks like you've gained a couple of pounds since yesterday. Your blood pressure's up just a bit compared to yesterday.
Today, HomMed was on the job, catching a slight weight variation, the type of problem that previously could have gone unchecked, only to land Tamika in the hospital.
It was where my blood pressure was up high and my fluid intake had went up about 4 pounds than it did yesterday. And there was a medical alert where it was to get my medication done immediately.
Small system, big results, and it's easy to use.
There's the monitor itself, which actually displays the results of the vital signs. There's a blood pressure cuff, and then there's a finger attachment that actually clips onto the end of the finger, and it monitors heart rate and oxygen saturation. And then there's a scales that's actually attached to the monitor, and it weighs within 1/10 of a pound.
And HomMed takes its job seriously.
Well, when I have been sleeping and it goes off, and if I don't just hear it and don't get up right away, it'll be still saying, "Now get on the scale."
It's a cutting-edge marvel that's redefining healthcare.
Patients want to be at home. When you're sick, you want to be at home. So if we can keep patients at home by catching things quicker, then we're saving money for the hospital, for the payer, for Medicare, for the insurance company, whoever is paying for that claim. We're actually saving, and the patient is benefiting because they're where they want to be.
And what does Tamika think of her high-tech healthcare worker?
It makes me feel wonderful to know that someone's there that really cares. I love it. I love it. It's a lifesaver.
Thank you for completing your vital signs measurement.
For Smart Medicine, I'm Rod Starnes.